Welcome to the Patient Advocacy Show. I'm Dr. Michael Warner. In this episode, I will show you how to complete a prehistory and discuss how to offer it to your medical provider. On January 1st, 2017, the Journal of the American Osteopathic Association, JAOA, published our clinical research paper, Use of a Patient-Authored Prehistory to Improve Patient Experiences and Accommodate Federal Law. This paper was authored by myself, Thomas Simunich, Dr. Margaret Warner, and Joseph Dado. Margaret and I represent patient advocacy initiatives, and Tom and Joe are part of the Conemaugh Health System. Please allow me to thank the co-authors for all of their hard work. I wish to also send sincere thanks to the Conemaugh Institutional Review Board that approved our research, and the JAOA editors and reviewers that helped us with publication. I want to thank the medical staff at the Conemaugh Health System Medical Office where we conducted the study to accommodate a patient's prehistory. And most of all, I thank the patients who filled out the prehistory in preparation for the visit and then reviewed the encounter note after the visit for content and accuracy. This JOA research paper is meaningful because it highlights the importance of your story. So important, in fact, that our research demonstrated a process that allows your words to get printed into the medical record. Our running hypothesis is that when your story is accurately told and documented, you will be better heard and understood by your medical providers. We believe this will lead to better healthcare for you. Okay, so here's your situation. You may develop a new medical problem, or perhaps you have a chronic medical condition. How do you express your concerns to your medical provider? Perhaps you make a mental list. I'm going to talk about this and this and this. Or maybe you write a list on a piece of paper and hold it while talking to the doctor. How does that usually work? Do you ever forget to mention a problem and then remember it on the way home? That is common. Mental lists and written lists are fine, but it is worth knowing that the list the doctor is trained to ask is very structured, and fields to answer these questions are built into electronic health records. Our government embraced and organized these certain terms as part of the CPT code set, and this was adopted as part of HIPAA in 2000. Today, we're going to focus on the history. The history is a series of questions that a doctor asks you during an interview part of the medical encounter. What brings you to see the doctor today? When did this problem first occur? What makes it better or worse? The complete list is about 30 questions. And as you can imagine, it takes a little longer than the time of a typical doctor visit to hear each question, remember and reflect, then tell the doctor, then wait for the doctor to type the answer into the computer, then ask the next question. What usually happens is that the doctor asks a few questions and moves on to doing the examination. Your story, however, and the details of the complete story are all clues. What if you were able to prepare answers to all the questions and hand it to your doctor at the beginning of the visit? That's what we did with our research. We actually went a step further and transcribed the patient's story, the patient's words, into the history part of the record. This means that the doctor has all of your words already in the computer. This allows your doctor in less than a minute to read and understand your whole story in the structure that he or she was trained. Now, legally, we consider the prehistory to be a patient's written request to amend the health record as a federal right per the HIPAA privacy rule. Please go to our nonprofit website, www.patientadvocacyinitiatives.org, and go to the left column. You will see 3 prehistory forms. One is ready to be filled out, and the other 2 are already completed as samples, one being for a new problem and the other being for an old/chronic condition. It is worth knowing that when you see a doctor, it does not matter how many problems you have. You only complete one prehistory. If you can, pause this video and print these out. The history is composed of the chief complaint, history of present illness, status of chronic condition or disease, review of systems, and past family social history. The chief complaint is the reason why you seek medical attention. If you have right elbow pain, then the chief complaint is right elbow pain. If you visit the doctor to care for your diabetes, high blood pressure, and high cholesterol, then that is your chief complaint. If you have a new problem, right elbow pain, and high blood pressure and high cholesterol as chronic conditions, then all three of those are your chief complaint. The history of present illness, HPI, is where you describe a new problem. The HPI asks a series of questions: location, quality, severity, duration, context, modifying factors, associated signs and symptoms. On our prehistory forms, we include little descriptions of each of these to help you understand. Let's use the example of right elbow pain, as in the one sample prehistory, for a new problem, posted on our website. By going down the list, you will learn how to express any new problem that you may have. Okay, chief complaint, right elbow pain. Location, right elbow. Quality, what does it look or feel like? Throbbing pain. Severity, rate how bad it is. For example, on a scale of 0 to 10, where 0 is none and 10 is the worst. Pain, 6 out of 10. Duration, how long have you had this problem? 2 weeks. Timing, when does this problem occur? All the time, just during the day, or just during the night? Constant pain. Context, are there any circumstances when this happened? Did something occur to cause this? Fell on the ice. Associated signs and symptoms, if you had some tingling in your right ring and little fingers, you could write that here. If a friend had a similar problem and needed a cast, and you thought you needed one too, you could write that here as well. The history of present illness, HPI, helps you describe a new problem. If you have had diabetes for the last 15 years, you do not want to describe your experience with diabetes with an HPI. Instead, you would use status of chronic conditions or disease. The status of chronic condition, as of September 2013, was accepted by CMS as part of both 1995 and 1997 documentation guidelines. The status of chronic condition is used in an example in the sample prehistory that reads Example Universal Prehistory Form Chronic Disease near the top of the first page. The status is basically an update of your condition or disease. In our sample prehistory, we address diabetes, high blood pressure, and cholesterol. In the status, we can address each of these. I take my medication as prescribed, and I have no side effects from them. Diabetes, my home fasting blood sugars run around 110 in the morning before I eat. I wear diabetic shoes. High blood pressure, my home blood pressures run around 124/74. Cholesterol, I watch my diet the best I can. I started working out in the gym 2 weeks ago. The status is not as structured as the HPI. It allows you to express how you're doing. In the next episode, I will discuss how to better cultivate the status. The review of systems, ROS, is a head-to-toe, mind-body inventory. Constitutional, overall, how are you feeling? Followed by eyes, ears, nose, mouth, throat. Cardiovascular, any chest pain? Respiratory, difficulty breathing or shortness of breath? Gastrointestinal, any trouble eating, indigestion, or trouble moving bowels? Genitourinary, trouble urinating, genital issues? Musculoskeletal, joint or muscle pain or stiffness? Integumentary, skin color changes, moles or rashes? Neurologic, numbness, trouble moving? Endocrine, fatigue, increased thirst? Psychiatric, mood changes, feelings of depression or anxiety? Hematologic, lymphatic, any bruising or swelling? Allergy, immunologic, seasonal allergies? That's a head-to-toe mind-body inventory. The little descriptors that we have under each heading are not complete. Gastrointestinal, for example, may include difficulty swallowing, rectal bleeding, or vomiting. If you experience a new problem with swallowing food, then you should complete a history of present illness regarding this issue. For many answers to the review of systems, you may have no problems and write no or negative. The last part of the history is the past family social history. This includes your medication list, allergies to medicines, prior surgeries, prior illnesses, change in lifestyle, and any change in family health history. If you are able to read and review your health record and nothing has changed in your past family social history, then this section is easy to complete. For example, if your medication list and allergy list are correct in your health record, then you can write same as my health record next to both the medication list and the allergy list. If you are not certain that your medication list in the health record is accurate, then write down all of your medications. Include the name of the medication, how often you take it, what it is used for. You also may want to include the medical provider who prescribes it and from which pharmacy you get the medication filled. Prior surgeries and prior illnesses allow you to list past operations and illnesses. You do not want to rehash everything you write in the HPI or the status. Ideally, you only need to do this past family social history area once in your health record, and the health record will store the answers. If you review your health record and find the section to be accurate and up to date, then often the answer is just going to be same as the health record. Change in lifestyles include marital status. Did you get married? Occupation. What do you do for work? Did you get a new job? Smoking, alcohol use, and recreational drug use. Change in family history is where you would update diseases experienced by your family members. If your father develops lung cancer, for example, it goes here. Electronic health record patient portals allow you to log into a secure website and view your medication and allergy lists. Unfortunately, the current standards for patient portals do not let you see the rest of your medical record, such as the history of present illness, status of chronic condition, or review of systems. If I had a magic wand, I would go boop, and your portal would show all of this. If you want to read your entire health record, or even read everything in your last medical encounter note, then you need to officially request to access the record per the HIPAA privacy rule. You would need to fill out and sign an authorization for release of protected health information form at your medical institution. By law, you are permitted to have the record sent directly to you. It does not need to be sent to another doctor. Your medical provider has 30 days to respond to you in writing. Your doctor will let you know if there is a legitimate reason why you are not allowed to view your record. You may be charged a customary fee for photocopying and postage costs. During our study, as part of our patient-centered health record transparency, we gave each patient a paper copy of the encounter note at the checkout window at the end of the visit. Someday, patient portals will include all components of the health record, and we will not need to devote so much of your time and staff member time and paper to let you see what is written in your health record. You may think, wow, this prehistory list is long. I don't have time to do this. I'll just let the doctor do it. I ask, how much of this do you think the doctor can do in a few minutes? The answer is not much. The interview experience for you may likely become a series of rapid-fire questions. Often in confusion, you may just say no to some questions that you really have concerns about. Completing a prehistory is worth your time. Medical encounter documentation is now structured as the history, examination, and medical decision-making. You do not want to spend your whole visit struggling with basic history questions, then only to rush through examination and medical decision-making. You want your doctor to understand your story as quickly as possible and as thoroughly as possible so you can have a pertinent examination and medical decision-making that transforms to shared decision-making. This is where you and your medical provider make decisions together. I suggest you complete a prehistory in advance of your next medical encounter. Let a family member, a friend, or a caretaker take a look at it. Reflect over your answers and modify them as needed. Our form only allows for a small amount of room for answers on purpose. If your prehistory is 20 pages long, no one, especially your doctor, will have time to read it. Remember, your prehistory is the beginning of a conversation, not the end. Now, your doctor may review your prehistory and incorporate what you have written into your health record. If your doctor values the information, he or she may read our research paper and copy our process of getting your words into the record. Some medical providers will not know what to do with your prehistory since it's a new concept. Your doctor may ignore it and throw it in the trash. At the very least, however, your efforts completing a prehistory will help prepare you or a loved one for an upcoming medical encounter. Why not fill out prehistory? Let me know how it goes. Thank you for watching this episode of the Patient Advocacy Show. Please join me in the next episode where we will cultivate the status of chronic conditions. To your health, I'm Dr. Michael Warner.